Remember to subscribe to our YouTube channel at NDN Nigeria. Click on the subscribe button and be the first to get notifications. Niger Delta Development Commission, NDDC, making a difference.
After about 5 years of abandoning one of its signature initiatives conceived to provide free medical services to largely underdeveloped communities in the oil-rich region, the Niger Delta Development Commission (NDDC) has demonstrated its renewed commitment to the health and well-being of the people with the relaunch of the program recently, where more than 2,000 patients received essential healthcare services at no cost. The Managing Director and Chief Executive Officer of the NDDC, Dr. Samuel Ogbuku, who flagged off a week-long medical outreach in Esiamudin local government area of Akwa Ibom State, noted that the Commission's free medical services will be sustained to meet the healthcare needs of Niger Deltans, especially those in hard-to-reach areas across the region.
Over the years, the Niger Delta Development Commission (NDDC) was known for its signature free healthcare medical program across remote and urban communities in the Niger Delta. Unfortunately, in the last 5 years, the program had to be placed on hold due to several challenges, including incessant change in the leadership of the Commission. However, the current board and management of the NDDC, led by Mr. Chiedu Ebie and Dr. Samuel Ogbuku, considered it imperative to revive the medical outreach program due to its efficacy in the past and the immeasurable medical support it provided for a lot of Niger Deltans who could either not afford the cost of such medicals or were simply in very remote communities without any medical facility whatsoever. At the recent flag-off of the renewed NDDC Free Healthcare Medical Mission in Akwa Ibom State, Managing Director and Chief Executive Officer of the NDDC, Dr. Samuel Ogbuku, who was represented by the Commission's Executive Director Projects, Honorable Victor Antai, said the outreach is aimed at eliminating financial barriers to medical services.
This is in line with the position adopted by Mr. President during the commemoration of the 2023 World Universal Health Coverage Day with the theme, Health for All.
Honorable Victor Antai further explained that the NDDC Medical Mission has continued to evolve in its approach in order to meet global healthcare standards and provide the best of healthcare services to all Niger Deltan. Some of the medical services provided at the 5 days free healthcare medical mission include ocular surgeries, cesarean sessions, issuance of medicated glasses, prescription of medications, and diagnostic procedures, among others.
The truth is, if this mission did not hold this week, what would have been the fate of those pregnant women? Would they have been alive? Would they have added to the poor maternal mortality rates in Nigeria? In the eye section, we've had 50 eye surgeries. Those are 50 blind people that now see.
Some of the beneficiaries of the free medical program commended the NDDC for the support, especially at a time when medical bills are expensive and almost unaffordable for the poor.
I thank the NDDC for the opportunity.
We want to use this medium to appreciate NDDC and the surgical team involved.
The NDDC Free Healthcare Medical Mission is projected to reach every community in all 9 states of the Niger Delta region. The program will continue in other states in the coming weeks.
Niger Delta Development Commission, NDDC, making a difference. Inside the Niger Delta,